Let's be honest. You search dental implant costs, you see one number, you relax, and then the bill arrives, and your jaw drops harder than the implant drill. Today we're pulling back the curtain. What are you really paying for? What gets quietly added later? And why two clinics can quote wildly different numbers for the same smile. Stay with us because one small detail could change your entire decision.
Exactly, Rasim. Most people think the implant is just the screw. In reality, that's only part of the story. Materials, planning, bone condition, even the surgeon's experience quietly shape the final cost. Miss one of these, and surprises appear later.
Dr. Esma, by the end of this video, people will know what questions to ask before they ever sit in that chair.
And more importantly, how to avoid paying for mistakes they never knew they made.
Here's a scene many people recognize. You're quoted a clean, simple number. You think, okay, manageable. And weeks later, you hear new words. Extra scans, added procedures, different components. Suddenly the cost is climbing, and you're already emotionally committed. Walking away feels harder than paying. It's sadness there.
And that's not because patients are careless, Rasim. Most clinics explain just enough to move forward, not enough to prepare. Bone quality issues, healing time, or the need for additional support are often discovered after the initial quote.
So people feel stuck. They think stopping now wastes time and money already spent.
Exactly, and that emotional pressure is where most hidden costs quietly slip in.
This is why it matters so much. A dental implant isn't a quick purchase. It's a long-term relationship with your health. One shortcut today can mean years of discomfort tomorrow. Dr. Esma, you've seen this firsthand.
I have, Rasim. I've treated patients who came in after choosing the cheapest option, only to face infections, loose implants, or repeated procedures. In the end, they spent far more than if it had been done correctly the first time.
And that's the trap, right? Saving a little now can cost a lot later.
Exactly. When people understand what truly affects dental implant costs, they make calmer, smarter decisions, and their results last.
Let's add some context. Many people don't realize how common dental implants have become. Millions are placed every year, yet the experience varies wildly from clinic to clinic. Same treatment on paper, completely different journey in real life.
That's true, Rasim. Studies and clinical reviews consistently show that complications often trace back to rushed planning. One mini case I see often is a patient skipping detailed imaging. Everything looks fine at first, but months later the implant struggles because the bone support was misjudged.
So it's not bad luck, it's missing information. See, here's the information.
Exactly. When the background work is done properly, outcomes improve dramatically and long-term stress drops.
Now, let's zoom out and put on the science glasses for a moment. Dr. Esma, when experts talk about dental implant success, what are they really measuring behind the scenes?
Great question, Rasim. Scientifically, we look at osseointegration. That's how the implant fuses with the bone. This process depends on material quality, surgical precision, and the patient's biology. If any one of those is compromised to cut costs, the long-term stability suffers.
So when someone hears a very low quote, it might signal a shortcut at a microscopic level.
Exactly. Science doesn't negotiate, and biology always sends the final invoice.
Alright, enough suspense. Let's get practical. If someone is watching right now and wants to avoid these hidden traps, where should they start, doctor? Esma, Mizanilan.
First, Rasim, always ask for a complete treatment plan in writing. That means imaging, materials, steps, and follow-up care. Second, confirm which parts are included and which are not. No assumptions. Third, ask about long-term maintenance and possible complications, not just the procedure day.
So clarity before commitment.
Exactly. When patients slow down and follow these steps, costs become predictable and outcomes improved dramatically.
Now let's talk red flags, because some mistakes don't look like mistakes until it's too late. Dr. Esma, what should people absolutely not ignore?
First, Rasim, never rush because of pressure or limited time promises. Quality treatment does not expire tomorrow. Second, avoid choosing a clinic based only on the lowest number. Ask why it's low. Third, don't skip follow-up care discussions. Long-term success depends on what happens after the implant is placed.
So it's less about hunting bargains and more about spotting warnings.
Exactly. When patients know the do's and don'ts, they protect both their smile and their peace of mind.